This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to talk about why doctors only spend 5 minutes with you when you see them in the office. So, as a patient, I know this is super frustrating. You make an appointment, it's a pain in the butt, you call the reception, you wait, you get there, you wait longer, sometimes an hour, 2 hours, you finally get in the exam room, you wait some more, and then the doctor comes in, doesn't even really look at you, and 5 minutes go by and they're gone and you don't know what happened and you owe some undisclosed amount of money. Whether you have insurance or you don't. So the question is why doctors do this and why is it like this? So I'll say first that doctors don't want to do that. They didn't go to medical school for that. They want to help people. But the way the system is set up, they're not allowed to spend more time. Meaning that most doctors now, especially in the primary care world, work for these large hospital systems. And they want the doctors to see as many people as humanly possible. So you'll have a clinical manager who's not a doctor, clinical manager, sometimes a nurse, and they'll build the schedule for the doctor. So, at least in the world of orthopedics, there'll be like 2 people at 8 o'clock, 2 people at 8:15, 1 at 8:30, 2 at 8:45 in a busy practice. And you can see quickly that there's just not a lot of time there. And then what's worse is it's all this documentation requirements. So your 15-minute visit is actually 7.5 minutes or less because the doctor's got to document all this stuff. And I think it leads to crappier care. It'd be like someone asking you to paint a wall and you only have 10 minutes to do it. You could do it. You could do a job. It wouldn't necessarily be a good job, but that's kind of where doctors are forced to be in, and a lot of them are very unhappy doing this because they feel like they can't really connect with anybody or provide the care they want. And this actually causes a high level of what quote-unquote burnout, which is a term I don't like because it's a victim-blaming term, and actually physician suicide, which is some of the highest in any profession. So doctors don't like it. They're forced into doing it. And if you're a doctor and you say, you know what, I'm going to spend more time with my patients, I'm going to spend 45 minutes, I don't care, you're going to get pushed out or fired. It's the same with a surgeon. If you're not operating all the time, they don't care if the indications are bad. They'll push you out. So you're stuck in a tough place. And the reason how we got here is that insurance companies have so many requirements in order for a doctor to get paid that it's created this kind of weird system where now you have to hire 10 people to just do billing and coding for you so you get paid. Well, now you got to pay all these 10 people that now work for you full time, right? Again, not adding anything to the doctor-patient relationship. This is all financial related. And now to do that, you have to see tons of people. And, you have to jump through all these hoops and check boxes just to get your billing levels up. So it ends up being pushed harder and harder. And now that hospital systems own most of these practices, well, they push it even harder. So doctors have even less time. And it actually works doubly for a hospital because not only do they get more revenue by having you see more people, if you don't have time to spend with a patient, you're going to make more referrals. And they make more money that way too. So it's kind of a really screwed up system that's really tied to the insurance system, why you only get 5 minutes. Now, that being said, if you want to spend a longer time with a doctor, if you find one in the cash world, which is where I am, and I don't take insurance, it's not for love of money, it's for hatred of insurance. I don't want an insurance company or hospital system telling me what to do. So I spend 45 minutes to an hour with a patient. I'll spend as much time as I need. It depends on the person. But the point is that when I'm not restricted by these insurance companies, I can spend that time. But yeah, it's really a sad state of affairs. Doctors don't like it, patients don't like it, and it just keeps getting worse. So that's the answer to the question why your doctor spends 5 minutes with you. Not because they want to, it's because they're forced to. If you have any questions I didn't answer or want to further the conversation, please leave a comment below and I'll do my best to respond. If you like this video, we put out content every week, so please like and subscribe. And thanks for watching my video.